Our second guest today is Rebecca Green, a nurse with Lower Cape Fear Hospice and Life Care Center. Well, welcome to the show, Rebecca. It's such a pleasure to have you.
Thank you.
Now, to begin with, I would like to learn a little bit more about you and your background and your education. So if you would share that with me and our viewers.
Okay, well, I got my ADN at Southeastern Community College, and after that I worked on the med-surg floor at Brunswick Community Hospital.
Wow.
And then there was an opportunity at Lower Cape Fear Hospice, and I had actually done some training while I was a student at Southeastern. So I felt like I fit really well with hospice and their philosophy. So I started working there as a home nurse about 11 years ago, and I did that for 8 years. And then there was an opportunity for a new position called the clinical nurse liaison, and I accepted that position, and that's what I've been doing for the past 3 years.
And I bet you're wonderful at it. You have such a great personality. I'm sure you do a great job at that. And that's such an important role.
Well, thank you.
It's a wonderful organization, and we're so happy to have you here today.
Thank you.
But we're here today to talk about fall prevention. And I understand that's a pretty important topic, especially in our senior population. But I'm curious, how often do falls really happen?
Well, studies have shown, surveys have been taken, and they say about 1 to 3 adults over the age of 65 will fall every year.
Really?
Yeah.
That's pretty significant.
It is. It is.
Wow. What seems like falls would happen mostly to seniors. Is that an accurate statement, or?
There's 2 age groups.
Really?
Over 65, and of course, as you increase in your age, then the increase of fall risk then goes up. The other age is 5 and under.
Oh, our babies, huh?
Trying to walk and learning how to navigate. They're the other risk factor.
Now, of course, when you fall, there's always the physical injury, and I assume it probably reduces independence and mobility. But are there any other things that can occur after a fall?
Well, patients usually then become afraid.
Oh.
So they're afraid they're going to have another fall. So they will stop being mobile.
Oh.
And, you know, when you stop using something, then you have a potential to lose it. So the mobility, the flexibility, the strength, the balance, all of those factor into then having a reoccurrence of a fall.
Well, how about risk factors? Are there certain folks that are more prone to falling?
Well, there are folks that have certain medical conditions that are more prone to falling besides just the age factor. You have people that have diabetes, and if you've had diabetes for a while, you start getting side effects, which we call peripheral neuropathy, where you can't feel your feet.
Wow.
So if you can't feel your feet, you don't know where you're stepping, and that can lead to a fall. Patients that have had strokes, patients that have lung disease, because when you try to do things and you become short of breath, you can then...
I never thought of that.
And then the other factor is the other patients are heart patients. And there are a lot of reasons why: medication that patients are on, lifestyle, home hazards.
Oh, yeah, that's probably a biggie.
Yeah.
Well, how can healthcare providers help someone if they are at risk for falling?
We think you need to sit down and talk with your patient, and you need to review their medications. It helps if you have one pharmacy. So you have one pharmacist looking at your medications, looking at the side effects, and a lot of times too with your dosing and your timing. So if you're on a medication for pain, but you're also on anti-anxiety, both of those medications can cause you to be drowsy. So you might not want to take those together. So there's a lot of drugs that interact with other drugs that you might want to talk with your pharmacy or your doctor about. Regular eye examinations, because as we get older, we need brighter lights. So if we're walking around in a house that we have 40-watt bulbs with oxygen tubing and rugs that are loose, then there's a lot of potential for falls.
So it sounds like a lot of it is common sense and just looking at your surroundings and being aware, more aware, and having good conversations with your physician as well as your pharmacy.
Absolutely. Physical activity and being able to admit, because we're also independent.
Yes.
And we don't want to tell our doctor or our spouse or our family, I'm having problems.
Well, Rebecca, I'm curious, are there any medical tests that can be used to identify the reason a person falls?
Well, a fall usually is the symptom of a problem, not actually the problem itself. So there are medical tests to find out what a disease process is, or if you've had some kind of acute occurrence. But usually a fall is a symptom of something
else that's
happening.
going on?
Yes.
Yeah, okay. Well, that makes sense. Does physical activity typically reduce one's risk of falling?
It does. Studies have shown that people who stay physically active have less incidence of falling. A lot of times older people aren't sure what to do, or you hear those things are good but they're high impact, so we have knee problems. So things like yoga, doing weight training with your legs to keep your legs strong, and Tai Chi, those things. And if you are one that goes to the gym, the elliptical trainer is better than the treadmill because it's low impact.
I was going to ask you that. I wondered what kinds of exercises would help, for instance, me to reduce the risk of falling. And I do go to the gym, but I typically use the treadmill. So you're saying elliptical may be the better choice?
Because of the low impact, yes.
And what about weights and machines versus isometric and things like that? Is there much difference, or would the outcome be pretty much the same?
I think it would pretty much be the same. If you're using this lower weights, you're not really going into do any kind of muscle building. You're just trying to do strength training. And it's all of that together. It's the flexibility, the strength training that help you reduce your falls.
How about Zumba, things like that, or dancing kind of exercises? Are those good?
High impact.
High impact.
Yeah. So depending on what other conditions you have, they may be fine or they may not be.
Right. Well, are there any tips out there that viewers could do around their house to prevent falls? I know you talked about the rugs and things like that. Can we kind of go over that again just to...
Sure. Anything, depending on where you are, if you're having problems, grab bars on the stairs.
That's a good one.
On
bathtubs, I would think might
the
be
bathtubs, beside the commode, shower chairs in the bathtub, because if you're having problems with endurance, you might have a hard time standing just to take the shower. So you get one of those shower nozzles that come down, get a shower chair, and you're good to go. Lighting is a big one. Cords, loose rugs, things like correct fitting shoes. Not flip-flops, more like tennis shoes, socks with the little skidders on the bottom so that you're not falling.
Right, those are all great ideas. That's great. Well, Rebecca, it's been a pleasure to have you here today. I know I've learned a lot about fall prevention, and I hope that our viewers have too. And we look forward to seeing you again in the future. We'll talk about a different topic.
That would be great.
Thanks
you
again.
so much.
You're welcome.